being here today. I'm Brian, and this is Sarah. We're with Suncrest Hospice, and Sarah is an RN for us, and she actually does a lot of stuff. We all kind of wear a lot of hats, but she does a lot of the admissions, and she's going to do a little presentation for you guys on body mechanics. And if you guys have questions along the way, we'll kind of keep this informal, just kind of interrupt, raise your hand, whatever you want to do, and ask questions as we go. So turn over to Sarah.
So it's actually going to be on preventing bed sores.
Yes.
And range of motion.
Yes.
So, okay, so I'm sure everybody is familiar with bed sores. Is there anybody who isn't familiar? Okay. So bed sores are created from basically pressure anywhere where you aren't allowed to have blood flow the way it normally should. So you can have, anywhere where you have a lot of, if your clients are laying in bed all day, think about all those areas that like your elbows, heels, bottom, back, spine, hips, between their knees, there's just anywhere where there's friction, you can get a bed sore. And there's different stages of bed sores. We want to talk about preventing them. So I won't get into different stages because hopefully we don't ever have to deal with the stages. I'm sure they happen, so you will, but so we want to talk about self-care for them. So number one is making sure they're clean and dry as often as possible. I'm sure there's patients who are incontinent, and so we just want to make sure that we're changing them and putting protection barriers whenever possible to the groin area, to the bottom, because a lot of, if you have urine or if BM, that can really kind of expedite the process. Also, even if it's just lotion on the arms, it doesn't have to be like barrier cream. It can be just any kind of helping the skin to stay hydrated. And then obviously the next step would be how you help manage their skin. So if they're getting, bed baths or helping in the shower, you don't want to use anything that's really hard on the skin. Maybe soft, gentle soaps, not really hard scrubbing. A lot of the elderly population can have really delicate, fragile skin. So we just want to be careful with how we scrub and those things. And then obviously there's the dragging and pulling motions that can cause, I don't know if anybody's ever seen that, but I've actually seen a poor little client's skin tear like tissue paper because it's just, So if whenever possible, when they're in bed, using a draw sheet is really like the best thing because their skin stays tucked and they just move with the draw sheet instead of, using an arm or things like that. So, and then nutrition, I'm sure you guys have heard this, protein is really important. If they can't eat, there's the protein shakes, staying hydrated. Sometimes people hate water. And so maybe if you do a little bit of fruit punch or Crystal Light or make it really cold, something that's a little bit more enticing because I know water can get boring. So something that can help make it seem a little bit, taste a little better. That'd be good. So, so while they're in bed, we also want to make sure that they're being turned at least every 2 hours, because when they're just lying there in the same position, that that's what causes it. So even if it's just you're laying flat, use the draw sheet to lift one side, put a pillow under there, then you've let this side start to have a little bit more blood flow, and then 2 hours later, same thing. And obviously with the elevating of the heels, you got to be careful with making sure that when we put a pillow under the knees, that the heels don't stay touching the bed, because then that's going to be a really,
Where can you get the little pads that you can put on your heels? You know what I mean? Just
purchase
those.
You could probably find some like on Amazon. I know a lot of companies
You
you
probably
could get them at like Walmart. Actually, I think they might have like little skin protectors. I think I've seen them there. Or Walgreens. Usually where there's like a pharmacy, they tend to have some variation of those things. But if clients are able to use Amazon probably, I'm sure, has it. Or Medline. I don't know if you need like a login for Medline, but I know Medline has a lot of great supplies as well. So yeah, that's a great you know, making sure that the heels are protected. But what I was saying about the knees is that if you put a pillow under the knees, if the heels stay touching, then it creates like a big problem for the heels there. So make sure they're floating, and you just kind of, if you can fit your fingers underneath, then they're floating. I said that to the clients and they're like, what do you mean floating? And I just tell them about the finger trick. If you can fit a finger under there, then your heels are floating. So, and then actually, if it's possible for them to have like a cushion for their bed, like a foam cushion or air pressure relieving mattress, those things are really great because they help relieve that pressure in those bony areas. If they're in a wheelchair, you want to make sure that they're fitted to the correct wheelchair. So if they're too wide for the wheelchair, then you're creating areas on the sides that could, you know, and so the doctor or the nurse should be able to tell you if they're in the correct wheelchair. Also, they have gel cushions for wheelchairs. So those are gel cushions. They're really nice. You feel them, they're really jelly and really, really nice. So those would be great to have for patients who are in the wheelchair a lot. And actually, patients in wheelchairs should be moved as well. So obviously you can't put somebody on their side in the wheelchair, but if you could help them, you know, lean a little bit more this way, then you're doing that same concept of in the bed as helping blood flow on this side and, you know, kind of alternating. Okay. And then if you're ever helping a patient transfer out of bed or a wheelchair, try your very hardest not to have them drag. I kind of talked about that earlier with the draw sheets, but in a wheelchair, you don't want them to kind of like scoot forward. You want them to like pivot forward if they can to the end of the seat. So you're preventing, hopefully preventing any skin tears in that area. Okay. And then it's also really important to inspect the skin as often as possible, whether if they can or if you can help, just looking at their skin every day if you can, just because pressure sores can just pop up in one day. And I don't mean like gross gushy ones, but even if it's just an area that's reddened, that can happen, you know, pretty quickly in a day. So checking their skin, checking their heels, anything that feels boggy, or if like the blood flow isn't within 3 seconds like it should when you push on it, those are things that you would let the family know, or let your coworker, your supervisor, I don't know how you guys, what your chain of command is, but just communicating that would be great, and making sure that their clothes fit them properly. You don't want anything that's too tight or anything that's creating wrinkles behind them, because that sounds crazy, but even just a wrinkle with too much pressure in one area can cause a breakdown. So does anybody have any questions?
I kind of wondered, when you were talking about the wheelchair and kind of moving them to the side to relieve pressure, is there things like wedges or things that help, or is it just creating the same kind of?
You can use there are wedges, there's small wedges, there's all different kinds of wedges. You can even just do like a rolled up towel or pillow, anything that's comfortable, and just making sure that whatever side they're kind of leaning on, that they have something on that side as well, like a pillow to lean on. So out there. Do you have questions? Okay, I thought I saw another. Oh,
I came in late, so I don't know what you talked about before.
it's okay.
But I have one client that does sit a lot, and I've noticed that specifically on one butt, she gets really she says it hurts, but it's really dry.
Okay, yeah. So kind of, I think maybe you missed that part. I was saying daily moisturizing is really important. Yeah, skin. It doesn't have to be like barrier cream you use for the groin area, the bottom, but for just regular body parts, lotion. I mean, think about, we live in Utah, first of all. So I came from Maryland and then I moved here, and it's like mummified out here, okay? Make sure the heels, because heels can crack. Make sure you're just lotioning, because lotion is your best friend out here in the desert. You want to just, even for yourselves. I mean, my mother-in-law gets little cracks in her fingers. So anything that you can use to moisturize would be great. Yeah.
So that's not necessarily the beginnings of a sore, it's just dry skin in that area.
Yeah, so yeah, that's kind of part of the prevention, because if it's dry, then it can crack and it can, you know, lead to more serious problems. So yeah. Yeah, of course. Yes.
Okay, but Sarah, when, okay, he has a really bad one on by the crack of his butt to the side,
Okay.
and they're putting barrier stuff on it, but I'm just wondering, you're between a rock and a hard place, aren't you? Because doesn't it also need to have a healing, you know, air?
You know, that's actually, a lot of people think that you need air for a wound. Actually, wound needs moisture.
Really?
That's the opposite of what you think. But you need the
But
wound.
can't
needs-
that harbor
To heal it.
infection though, right?
Motion.
It
will heal
can, but if you're cleaning it daily
Mhm.
and you're applying what, you know, that, if you just leave it moisturized, covered in dark covered area, yeah, it will definitely get affected. But that's why they should be cleaning it with like a wound cleanser and changing the dressing, because if it's soiled and it's sitting moisturized in like a pussy dressing, that's when you run into problems. But you want to make sure that the dressing is clean, dry, and intact and covered. Yeah, clean, dry, and intact, and that the wound, and I don't know what the circumstance is, but if it continues to worsen, they may need, you know, a higher level of care for the wound. So,
Well, I just didn't think that, you know, when a person would fall or something like that and break something, you could see that could be what could take them. But it's amazing to me how now this might be something that would
oh
that
yeah,
would take him.
yeah,
And I just never fathomed that, you know what I mean? Because they're trying to rotate him and stuff like that, but he's a pill.
he doesn't like it.
He doesn't, you think? Yeah, I don't like going like that. You know, you're damned if you're doing, damned if you're not.
Yeah, and that's something too that you have to kind of consider, really. I don't know his circumstance. I mean, I'm a hospice nurse, so for my circumstance, a lot of times patients aren't gonna get better. I mean, I don't mean to sound morbid, but they just either don't want to or they physically can't. Yeah, and so if that's the situation, then we wouldn't really worry and push him past to the point of discomfort for himself. We would just try to keep the wound from smelling and keep it as clean as we
Yeah,
can.
they're doing a little stuff. I'm just saying, when I seen that very thing, and then I've seen how it changed in just a.
They can.
It just broke my heart, you know?
I'm sorry, it's hard. Wounds are a hard thing to,
We were
To
trying to
see
see that,
and
you know what I
help.
mean? Doggone it. And then all of a sudden, just like you say,
yeah, it does. It happens fast.
and
It
I
can.
never expected it. Either.
I'm sorry. I can tell you really care about your patients. Okay, anybody else have any other questions about bed sores? Okay,
It sucks.
they do suck. We'll end with that. So remember, try to prevent them if
That
you
wasn't
can.
In conclusion.
Okay, the next little bit is going to be about range of motion. There's two kinds of range of motion. Does everybody know what range of motion is? It's okay if you don't. So range of motion, I guess I'll start. It's just with the movement of joints. So we have lots of joints all over our body. And, you know, if you don't use it, you lose it. That's something I remember a long time ago that I learned. And it can happen to anybody. Young people who get into accidents, or, you know, if for some reason, if you sat and didn't use your legs for like a week, you probably start to have some muscle atrophy and some contractures starting to build. So dealing with patients who are a higher risk, who are wheelchair bound, bed bound. I mean, do you guys think that these are a population of people who may have a higher chance of developing contractures? So as a caregiver, there are some things that you can do to help. So there's two kinds of range of motion. There's active and passive range of motion. Anybody know what active range of motion is?
Active range of motion is when they do it. for themselves.
Yes, like us, like right here, I'm moving my arms around. This is me actively doing range of motion, even though I'm not purposely trying to. But yes, just your daily things that you do every day. Passive range of motion. So anybody have any guesses what that is? Right, exactly.
It's what?
Is when the caregiver, somebody else does the range of motion for a person. So something to remember with range of motion, I'm gonna have, actually, somebody want to be a volunteer? Anybody? Right with that?
Right here.
Okay.
Oh, no. Come on up.
See, if nobody else will, I will.
So
I
something
mean, you
you want,
can.
Oh, no, absolutely.
I don't know, I'm too intimidated to try to do something with those arms over there.
She might hurt me.
Okay, so if you want to just sit right here. So something you always want to remember with range of motion is you want to support the joint that you're working with if you can't, like, let's say we're going to do this, okay? And you want to put your arm under, and you never want to, actually, I'm gonna say something. Okay. So I want you guys to observe what I'm doing and tell me what you think might be wrong about this, okay? Hi, Miss Jane. I'm gonna do some range of motion on your right elbow, okay? So we're just gonna do this to help your joints stay a little bit flexible, okay? All right. Okay, so I'm going to push your elbow up and down, okay? Ready? Oh, it feels a little tight there, but we're just gonna try to keep pushing forward, okay? We wanna straighten as much as we can. Okay. All right, you're doing great. We're just gonna keep going there, okay? All right. Anybody see anything wrong with that scenario? Yeah, it hurts.
Yeah.
So, and yes, forcing it. So she couldn't move past, maybe like a 45, or no, that's bigger. I don't know. She couldn't go past this point. 60, yeah. And I was pushing, and she was grimacing, she was in pain. So something to remember.
Sarah, is you're talking to your see.
Yes,
That is important.
for sure. Thank you for pointing out the good things. Yes, I was gonna do that next, so you beat me to it.
Oh, I'm
So
sorry.
it's okay. No, that's okay. So you never, ever want to push past the point of discomfort. It's okay to push a little bit past resistance, but as soon as they're in pain, you can't keep going because you could cause a lot more damage. So the point of range of motion, you can go back now. Oh, thank you so much. Good job.
Oscar Willard.
You missed your calling of acting.
These days, Oscar Willard.
So yeah, we want to prevent contractures. So if you can do this from day one, not just this, you can, bring the arm out, any way that your joints are supposed to move. If they lay on their backs, you can try to bring their knees up as far up as they go. Have them do this with their wrist, help them with that. Range of motion is pretty intuitive as far as what the body will naturally move. Yes.
What are contractures?
Oh, so contractures. So in order to bend your arms and you have ligaments, joints, muscles that make this happen. And a contracture is when it stiffens and it no longer is able to do that.
It's
So-
like an extension, so it's no longer able to extend.
It's no longer to extend or flex or it can even happen in the fingers. They can stay like this. So if you have patients who do that, we recommend putting like a little washcloth rolled up at a patient who got sores from digging his nails into his palms. So little rolled up washcloths are, yeah.
That's the opposite of atrophy, right?
Atrophying is your muscle.
Yeah.
So it's when you lose muscle.
Right.
So yeah, it's not really
I guess,
opposite,
okay,
it's just
yeah,
a different,
you're right, okay.
yeah, it's just a different body part. But yes, usually with contractures, atrophy follows, because if you're not using it, then you're gonna use your bicep, you're gonna use your bicep muscle follows.
So contractures is
The joint,
the joint.
The ligament, yeah.
Okay, okay.
that lets it, yeah.
Thanks.
So yeah, it's pretty intuitive. Doing it, twice a day at least would be good, more if you can. It's pretty simple. If they have really heavy arms and aren't really helping, then that can be a little bit harder. So make sure you're protecting yourself and not hurting yourself in the process. But range of motion is your best friend to help them with their mobility and their flexibility. So you guys have any questions on that topic? Hey.
Well,
Yeah.
so you say to do it twice a day, but like if you are moving 5 minutes, 2 minutes, 30
Yeah,
seconds.
I would say if you could do each exercise at least, 5 times. It doesn't really have to be by minutes because some people might be a little bit slower, but at least if you could do each one at least, like 5 times. If they want to do it more, that's great, but I would just do each one like 5 repetitions at least. So if you think about it, there's a lot. So you would be spending a lot of time. Like if you did 5 minutes per, then you're going to be spending like 2 hours doing all the joints in the body. So
I just wanted that clarified.
yeah, no problem.
A lot of questions.
Of course.
So it's easy to support a joint if it's down.
Right.
But what if it's like the knee or the shoulder?
So the
How do
knee,
you
so that's where you can. So like the knee is like where I was saying they're heavy, you do what you can. Try to do it in positions where they're resting. So like if they're going to sit down,
Okay.
like if they're sitting in a chair, then the chair is holding the brunt of the weight and you can try to put underneath and help them that way.
Okay.
So just do the best that you can. You're not going to be able to lift. And like with the shoulder, you can't really, more it would just be like just lifting the arm for them, because you can't really stabilize the shoulder. It's just part of your body. So yeah, just do the best with kind of your judgment as far as, we just don't want them to like be dangling or you drop it on accident and cause.
Oh, yeah.
Got it.
I mean, it can happen on accident, you know, without really, because if they're weak and you're not helping them here, they may, you know, just kind of budge. So, okay.
Thank you.
Did you have, you said you had lots of questions.
No, I just.
Oh, you just meant in general. Okay.
Repeatedly asking them.
Okay, so,
I mean, I can figure out another one if you'd like.
hey, I love it. I have a lot of questions. I'm a question asker too, so I love it. Don't worry about it. Okay, well, it's pretty short and sweet.
Can I
Yeah,
go back on the-
yeah, of course.
Is there any kind of particular thing that we can get that from?
No, what do you, oh, like the pain.
Right, and that's where.
So sometimes people use like lidocaine gels, but it would probably be better to consult the doctor, because if, I'm not sure what, if it's open or what, if they're gonna have reactions, or, you know, it's best to just ask the doctor what they recommend.
Just they're sitting quite a bit, but yeah, probably wouldn't.
Yeah,
I mean, there's not a spray or something.
I would recommend asking the doctor, because as far as it being open and infected, I don't know if I would recommend spraying some kind of thing on it that could, you know, it may end up being something that they may just have to take orally to take away the pain.
I just wish you could go around the buck, you know. So we could.
And there may be some, like I was saying, there's lidocaine creams, but I wouldn't feel comfortable, you know, going and buying something without consulting with the doctor or somebody first. So you could, it'd be better to, yeah, they would know for sure. So. Okay, anybody else got anything for me? Hey, you guys are awesome. I can tell. You guys all really care about your people. So keep being awesome.
They're our family.
They are. You are their family. You're there a lot with them. So